From that first plan in 1996, where we had a budget of $802,000 and served 1,100 patients, to today, 370 employees, 785,000 patient visits, with a total budget of around $77 million a year. We had 3 nonprofit partners in 1996 in the community. Now I can't even name them all. There's 90 of them. They're receiving funds from us to the tune of $25 million a year. The key element of our organization's support to small nonprofits is that we've stabilized nonprofits that didn't have any money to expand their services to more of the patients that they needed to be expanded to. So we've provided great stability to the communities that we serve. Plus, we've enhanced those nonprofits to provide an additional amount of services in every community we've gone to. In Corpus Christi, as an example, we worked with that community for 5 years to create the FQHC because one didn't exist. And we've done a lot of that creation in a lot of different communities. Those 2 doctors we had in 1996 were working out of the old Wesley Community Center. That process of building a new center, a new site, putting more physicians and more staff at that place has dramatically changed the area around the Wesley Community Center, now the Wesley Health and Wellness Center. You just can't imagine how their lives and their families' lives and their neighborhoods' lives have changed dramatically because of what we've done. The board's strategic plan said, let's do a couple of things. Well, primary care, dental care were a couple of those. And then they wanted to get involved in parish nursing. And we came up with the Wesley Nurse Program. Our parish nurse model is the largest in the nation. And talk about having an impact on community. Each of these nurses in each of these churches is out there every day and creating the relationships and the partnerships that then result in other contracts in this organization for the provision of primary care and dental care and counseling services and mental health services. The New Testament tells us to take care of people where they are and to provide services and care, and that's how we get the primary care and the dental care model. But the Old Testament out of Micah tells us to work on social justice. And you can't get justice without working on policy. And if we could change a policy, we could change the lives of more people. And there couldn't be a better policy guidebook for Methodist Healthcare Ministries than the Methodist Church's social principles. In the 20-year history of Methodist Healthcare Ministry from 1996 to today, we've invested nearly $700 million in these communities, and we've almost touched 8 million patient visits in that same period of time. Amazing amount of work. And just think of all that we'll be able to do into the future. The key element to our success as an organization has been several things. One, our connection to the Methodist Church. Without being connected to the Methodist Church, we'd lack a guiding post. We have it. We also have a dedicated board made up of 60% Methodist. And that board is absolutely tied into strategic planning. Every 4 or 5 years, we do a plan. We look at what we've accomplished. We don't sit down and say this is enough. We use our Wesleyan quote to say, nope, it's not enough, we have more to do, and we figure out what that is. And that will continue to give us great success into the future. If we stay faithful to our faith traditions, and if we stay faithful to the least funded, unfunded patients and clients that are in need in South Texas, then we're staying faithful to John Wesley.